Hi, this is Dr. Sharabi from Prestige Aesthetics Clinic, and we have our lovely patient today. I mean, she's looking amazing. We've done some work, and we have some stuff also for natural looking improvement. But today we are doing the tear trough, which is that little gap that you can see here. That really, our goal is to fill it where it is a little bit better appearing. You know, the goal is never to be 100% perfect, but the goal is always to improve and enhance the beauty. So the way we're going to do it, we're going to go with a cannula from here, single poke.
Okay.
So 3, 2, 1. How are you feeling?
Good.
Any pain?
No.
Finished doing the tear trough with a special filler that we had to use to fill in the troughs, and we did it with a cannula. And this usually takes a little time to settle down, so if somebody has a major event, we tell them do it at least 3 to 4 weeks before. If we're lucky, it looks perfect from day one and stays perfect like that. Sometimes it's anticipated to have some swelling for a few days. So typically this material in this delicate area, because it's a tight area with tight lymphatics, it may swell up a little bit more than usual, like lips or other areas. So the swelling may stay for 3-4 days. Tear trough filler, who would want to do it? First of all, you need to have good cheeks. If you don't have good cheeks, you are not a candidate to do a tear trough. Well, we get a lot of patients, they come in, they say, I want to fill my tear trough because since they're young, they have a genetic predisposition to have hollowness under the eye, and that bothers them all their life, and the first thing they want to do is the tear trough. But sometimes people are not lucky to have good cheeks, or they have not worked on the cheeks to get good volume, and those patients are not candidates for tear trough filler. So selection of the candidate is very important. You need to have a well-defined groove. Otherwise, you know, I turn away a lot of tear trough fillers. A lot of my patients, they're like, why? I came here for a tear trough filler and you're not going to do it. I said, no, because then the tear trough will look higher than your cheek, and that will never look good, and it will be a never-ending problem, because it will also start attracting water, and everything is very delicate there, and it's going to show pretty bad. So very important, the right selection of the candidates, and usually it's the hollowness. If you have a well-defined hollowness under the eye, like a groove, then I can fix it and I can make it look a lot better. Obviously there are other options like surgicals. I always discuss it with the patients, but for the right patients, they're going to be happy. This typically lasts with the patient more than a year because this area has less traffic, less muscle activity, and not much movement. So this filler tends to last a longer time. In certain patients, when we do it, they get a lifetime results because there are some fibrous bands holding the skin down, and with my cannula and the way my technique works is that it disconnects that fibrous area, so they don't need to do it for the rest of their life. I have patients who's done it once, and that was like 5 years ago, and she never had to do it again, and she looks perfect all the time. So if we're lucky, we'll be one of those patients. Keep your fingers crossed. Come see us at Prestige Aesthetics Clinic. We're on right south of Palmetto on Dixie.